Good evening, everyone, and welcome to Wellness Matters, a new show by the American Hospital in Dubai, which will shed light on a number of medical topics and health issues live on Facebook and YouTube. We look forward to engaging with you, so please make sure to post your comments and questions in the live chat. Our first episode will focus on cosmetic procedures, whether surgical or non-surgical in nature, from body contouring and fat transfer to less invasive procedures such as simple enhancement, for example, Botox and fillers. After all, who doesn't want to look better if they can? For more on these topics, it gives me great pleasure to welcome Dr. Frank Conroy, who is a consultant plastic, reconstructive and cosmetic surgeon in the region with 20 years of experience. He is also the chief of surgery at the American Hospital in Dubai. Dr. Conroy obtained his medical degree from Leeds University in the UK, and he also undertook higher specialist training in the UK, Ireland, and North America. Dr. Conroy is also a fellow of the Royal College of Surgeons in the UK and a member of the Emirates Plastic Surgery Association. Dr. Conroy, thank you so much for being with us tonight.
Look, many thanks for inviting me. I'm glad to be here. Thank you.
Let's start first by highlighting the current trends when it comes to cosmetic surgery in the region, and to what extent are they dictated by beauty fads around the world?
Working in Dubai, obviously we see patients from all over the world, and it makes for an interesting discussion when we meet with these patients, because they're coming from such different places in terms of their plastic surgery. If we look at Western Europe, their plastic surgery tends to be perhaps a little more reserved, whereas in other areas of the world they tend to want to be a little more perhaps daring with their plastic surgery and want to be noticed. So working here in Dubai, it's fantastic to see all these different trends, different countries, and patients coming to us with different requests and expectations. So if we look for Western Europe, patients want, I often get told, I want to have plastic surgery, but I don't want anybody to notice. Whereas we'll see patients perhaps from South America who are more comfortable with their plastic surgery, who want people to know that they've had it done.
Obviously, men are now more interested in cosmetic procedures. So what is most in demand by men, and to what extent does that differ from what is demanded by women?
Certainly in my practice in the last 5, probably 10 years, there's been a huge increase in male plastic surgery. There's the non-surgical treatments, which are very similar to what the females request, Botox, even fillers. But by far the commonest procedure would be liposuction, particularly to the male chest. Here in Dubai, we live in the pool, the beach. Men want to be able to remove their shirts, and they don't want the moobs, as they're known. Liposuction for this is a fantastic treatment. Whereas, the men perhaps are looking to reduce their chest size. With women, perhaps we're looking for augmentation, but certainly they both have the common interest of fat reduction, and liposuction for both male and female is very, very common.
Let's start actually by talking about the less invasive procedures when it comes to cosmetic procedures. Obviously, fillers and Botox are probably the most common. So when picking a surgeon, what should you look for when choosing a product to inject into your face? What should you choose? And what concerns should you watch out for, or maybe possible allergic reactions?
Very, very good question. Because Botox and fillers, they're almost seen as just an everyday treatment, no different to perhaps going to the hairdresser. With that in mind, we must remember it's still a medical procedure. We're injecting a drug to get a result from it. So it's really important that we treat patients properly. So how can a patient protect themselves? So number one, seek a appropriately qualified practitioner. So ideally a board certified plastic surgeon, board certified dermatologist. Make sure that the environment that you're being injected in is correct. So make sure that it's an appropriate clinic or hospital setting. And that way you can ensure that, number one, the product that they are using is more likely to be an original product. They're diluting it as directed by the manufacturer, and you're being injected in a sterile, clean environment. When you mention about allergies, allergies thankfully are exceptionally rare. But again, going back to the appropriate practitioner, the appropriate environment, the clinic, the hospital, if you do, happen to have an allergic reaction, at least there are the appropriate drugs available to counteract any allergy should they be required, and the appropriate equipment should it be needed and called upon.
Now, obviously, when it comes to fillers, what are also the most common areas of the face where fillers are used, and what are the different types of fillers?
So fillers, certainly the fillers that I tend to use in my practice, and by far and away the commonest, would be the hyaluronic acid fillers. The advantage of these fillers is, number one, hyaluronic acid is a naturally occurring filler, but more importantly is that we can reverse its effect if there's a problem. So we can inject something called hyaluronidase, which is an enzyme that can break it down. So in terms of safety, it's number one. So when we look at injecting fillers in typically the face, we tend to treat the cheeks, the lips. Sometimes we'll treat the nose for what we call non-surgical rhinoplasty. But again, going back to the appropriate practitioner, we need to select the correct filler for the correct anatomical site. They tend to come in in a spectrum, should we say, of different types, ranging from very thin, silky, smooth fillers that perhaps we'd use in delicate areas, under the eyes, for example. Whereas if we're looking for more volume in the cheeks, for example, we would use a heavier, more cross-linked filler that will give us more volume. But if we were to place it too superficially, we'd perhaps run into trouble with contour irregularities, lumpiness, which obviously we want to avoid. So selecting the appropriate filler for the appropriate anatomical site is vital.
Do you think people with thin skin are appropriate candidates for fillers, or should they avoid them?
No, with thin skin, you can gain fantastic results. We just got to be careful, be wary of how we inject, because obviously thinner the skin, we can end up with perhaps more bruising. And sort of also what filler we're injecting. So perhaps we'd steer clear of those very heavily cross-linked, use sort of smoother, silkier, lighter fillers.
Now, obviously, aside from fillers and Botox, there's also the procedure of fat transfer, where you can actually transfer fat from a certain body part to your face, which might have more long-lasting results. Can you walk us through the procedure, downtime? Is anesthesia required?
Sure, absolutely. So fat transfer is where we would take fat from one anatomical site and transfer it to another. Typically, the face or the buttocks would be sort of the most popular areas. So if we're looking at the face, for example, we would perform liposuction under local anaesthetic. Only a small amount of fat needs to be harvested. And then we process the fat. And rather than have these large sort of globules of fat, we can process it to such an extent that we can turn it into what we call micro-fat grafting or even nano-fat grafting, where we're turning the size of the particles smaller and smaller. And what this does, it basically avoids the dreaded sort of lumpiness, particularly we're mentioning about the thin skin. It almost eradicates that issue. And we can place that fat anywhere we like. But again, going back to the fillers, where we might be needing big volume, so in the cheeks, for example, we'll keep the particle size relatively large. If we were looking for, the delicate areas around the eyes, the tear troughs, we might use, the smaller particle, the nano-fat grafting. But it can all be done office-based. The important thing, like I say, is sterility, the appropriate environment, and being able to call on your surgeon or doctor should you have any concerns.
So how long does the procedure actually take?
So the procedure to liposuck an area of just a small amount, it only takes maybe 10 minutes, 15 minutes to harvest. Then we have to process the fats and then inject it just like we would with filler. So all in all, the patient could come to the hospital and be seen and treated within an hour or so.
Oh, that's quite quick.
Absolutely.
Okay. Another part of or related to the face basically is the neck, where a lot of people are concerned, whether it's about extra fat or aging. So let's discuss some of the procedures that are available out there for the neck.
Sure. So, like you say, the neck can sometimes be a bit of a giveaway in terms of age, particularly in women. You know, men can hide the neck with beard growth, etc. But with women, it's a bit more difficult. Now, there's, again, a spectrum of treatments ranging from the sort of the non-invasive or the lowest invasive techniques right through to the most invasive. And it's important that you understand your patient and manage the patient's expectation. The most sort of invasive will give the most aggressive, most sort of the biggest wow factor. But it's not for everybody. You know, the thought of having a surgical neck lift scares many patients off, and they want something that perhaps is a little less invasive but still going to give a result. So one of the most popular treatments on the neck that we offer here would be liposuction to the neck, often coupled with a relatively new treatment, J-plasma or Renuvion, as it's known, that helps tighten the skin as well.
I think we have a video to show that procedure actually for the neck liposuction
Sure.
with J-plasma. I think we're seeing it right now, doctor. Can you walk us through this procedure? What are we actually seeing?
That's right. So this procedure here is the J-plasma. The neck has been liposucked, and we're using the J-plasma, which is ionized helium. How does that translate to a medical treatment? Basically, it heats the skin from underneath. But, and this is the sort of the magic of this treatment, because of the way the heat is dissipated, the risk of injury to the skin is absolutely minimal, and this is where it has the huge advantage over other sort of thermal skin tightening devices, and it works so fantastically well.
So, but you would need to be under anesthesia to be able to go through J-plasma?
Not necessarily. No, it can be done under local anaesthetic or under general anaesthetic. It's really dependent on the patient. General anaesthetic, some patients, it scares them. They don't want the general anaesthetic and will only have local. Some, the thought of having something done under local anaesthetic, it scares them. So we'll have that conversation, and we can come up with something that's mutually agreeable.
Now, let's actually see the before and after pictures
Sure.
of this procedure on the neck, if we can, please. So, this is the before and after. How much after the procedure is the second picture?
So the patient underwent liposuction of the neck and followed by J-plasma. There's 3 tiny incisions, one behind the ear, one in the chin, and one behind the other ear. And that picture is just 4 days after the procedure.
And when would you see the best result?
So the final result, with any liposuction, you're probably looking at between 3 and 6 months.
Wow.
Yeah, it does. But when we're achieving a result sort of like that
already
at day
it looks
4,
really good
exactly.
after 4 days.
But the skin will continue to contract and to tighten, and she'll go on to get a further improvement in that.
Now, J-plasma, you mentioned it obviously for this procedure,
Yes.
but J-plasma can also be used on so many different parts of this of the body.
Correct.
And the face. So can you just walk us through the J-plasma procedure? Where is it most effective? On which parts of the body?
So when we use J-plasma, we use it in conjunction with liposuction. Now, liposuction can be performed on any area that has stubborn fat. So the neck, arms, abdomen, thighs. But the important thing with liposuction is that we're dependent on that contraction of the skin. And if that contraction of the skin doesn't happen, then we can actually end up with a worse result. So those troublesome areas where we can sometimes struggle with that contraction would be those areas like the medial thigh. The inner thigh is a classic area that just doesn't tend to tighten. Perhaps an abdomen that has had pregnancy and there's some sort of some stretch marks there. The skin quality might not be perfect. The Renuvion, the J plasma, really helps that contraction and gives that sort of helping hand that the body needs.
But can you go for J plasma without the liposuction?
Yes, you can, but the way that it works, we need to be able to tunnel under the skin to be able to tighten some of the fibrous bands that connect the muscle to the skin to help it really tighten.
So basically they go hand in hand?
They go hand, typically
Okay.
they go hand in hand, correct, yeah.
Okay. Aside from lipo for the neck,
Yes.
let's say we want to tackle aging.
Yes.
What are the best procedures available?
So in terms of aging of the head and neck, like we said, there's the non-surgical ranging right through to the surgical treatments. But there can be sort of more than one issue to be addressed. It may well be that actually the neck isn't fat, it doesn't have any excess fat, but you know, with again living in the UAE, there's pigmentation, there's very fine wrinkles, and it may well be that a laser procedure, a laser peel using either the carbon dioxide or the erbium YAG laser will resurface the skin. It will get rid of all the pigmentation. It will also help tighten the skin, smooth out some of those fine lines, and that can be used anywhere on the face. The sort of the most aggressive anti-aging treatment would be a face and neck lift, but again, it's not for everybody. Bearing in mind a longer downtime, scarring in front of the ear, extend behind the neck, and to be honest, here in Dubai. Compared to my practice back in the UK, I don't perform as many facelifts, maybe because the demographics, you know, in the UK, it would be 60s, early 70s for that procedure, whereas here in the UAE, we tend not to see that age group.
But possibly possibly another procedure might be the mini lift. Since the age group probably for a mini lift would be somewhere around mid-40s to early 50s, I would say.
Absolutely. The sort of the ideal mini lift should be minimally invasive, number one, but also give some longevity. You know, we don't want it to last a year, 2 years like some of the thread lifts. We want it to last a reasonable amount of time. And the max facelift, the minimally the max facelift, first produced by Dr. Tonnard in Belgium, involves a very small incision just in front of the ear and a lift, a cranial suspension, where we basically advance the soft tissues in a vertical plane to be able to basically restore the way the face looks. Because if we go back to the 1980s, when we think of those horrible windswept, sort of pulled back facelifts, that's not how we age. When we age, we lose volume in the face, we get descent. So what we want is to put that back where it should be, and the mini or the max facelift works exceptionally well for this.
So what is involved in the mini facelift? Like, what's the downtime? How do you need to spend the night in the hospital?
So it can be done as a day case, it can be done overnight. It involves smaller incision, so the max is minimal access, so it's a smaller incision. And there's a layer between the skin and the muscle called the SMAS layer. And what we want to do is to hitch this up, typically using 2 or sometimes 3 sutures, which really advances the soft tissues. It restores them back to where they should be. It restores the cheek volume. It can improve the jowl, and we can remove any small amount of excess skin. And it lends itself so well to women perhaps of a younger age, you know, the 40s, early 50s, where they're just starting to see some of the sort of the facial sagging, unfortunately.
Another area would be the eyes.
Yes.
Obviously, with age, you have more wrinkles, maybe sagging eyelids, droopy eyelids. So there is a procedure to improve that, Blepharoplasty, if I'm correct.
That's right.
So can you explain this procedure to us, please?
So blepharoplasty surgery typically involves removing skin from the upper or lower eyelids and occasionally fat as well. It can have both a cosmetic and a functional reason for performing this. Often people will complain of heavy eyelids, and it can affect their visual fields. The surgery itself is relatively straightforward. It can be performed under local anaesthetic or general anaesthetic, and it involves an incision, usually in the crease of the upper eyelid. For example, we remove an amount of skin and it's stitched up, and the whole procedure takes about 1 hour for both eyes. Occasionally there's a little amount of swelling, small amount of bruising, but the results are instantaneous. It really does open the eye up and can improve sort of a heavy hooded eyelid into, you know, restoring the shine and the sparkle back into the eye.
And I think we have photos to show this, Doctor, before and after pictures. Can you just explain what we can see?
That's right. So this is a young lady that came to see me complaining of heavy upper eyelids, and this was performed under local anaesthetic, and it basically involved the removal of the excess skin. But again, from the picture you can see that there is no scar. You can't see it. The only time that you can see the scar is when your eyes are both shut.
But will you continue to see the scar forever, or will
no,
it just fade?
It will fade, and although the eyelid skin is exceptionally thin, thinnest on the body, it heals so beautifully well.
We also have another picture of a male.
So this is a gentleman that came to see me more for a functional reason as opposed to a cosmetic reason. He was finding that the eyes were getting so heavy. He's a business executive spending a lot of time flying, and he was going into the boardroom with people asking, oh, why are you so tired? And he's like, I've just slept for 10 hours, and it was heavy, heavy, heavy eyelids. And you can really see that the upper eyelids have been treated. They've had the blepharoplasty done. Again, skin excision only, and it's really opened the eyes up. You know, now we could say, well, what about the lower eyelids? And sure, we could have performed a lower lid blepharoplasty, but again, the patient wasn't interested, didn't particularly want that. So we went with the upper eyelid, and he's absolutely over the moon.
And what are the concerns here regarding, let's say, anything going wrong and then your eyes don't shut?
Sure. So the term for that, lagophthalmos, where the eyelids won't close properly. And again, it boils down to selection of your surgeon. So the surgeon should measure multiple times. So we make sure that the patient, when both they're sitting and they're lying back, when we mark them, that when we pinch the skin, we make sure that there's always sufficient skin to close the eyelid. It should never happen, as you describe, in terms of the inability to close the eyes.
Because it can't be remedied.
It can be remedied, but it's quite an involved procedure. It can sometimes involve skin grafting, which we really don't want to go down.
Oh my God. Okay. Let's move on to the body now, because obviously everyone's concerned about the amount of fat they have on their bodies. And I think after the COVID-19 lockdowns, we've all gained some weight. I know I have. So let's start with the less invasive procedures, such as fat freezing.
So fat freezing, or sometimes known as cryolipolysis, involves the cooling of fat cells to a sufficient temperature. It doesn't actually freeze the fat. We don't cause any frostbite or anything like that. But what it does do, it cools it to a sufficient temperature that triggers the death, basically, of fat cells only, not the skin. It was first sort of recommended by the FDA in 2010, so it's been around for a while, and it's really improved over the last few years. The original hand pieces that were utilised were quite bulky, and as a result you could only really treat certain areas, and that's because the skin has to basically sit between two cooling plates. So smaller, more difficult areas to access were really not available for fat freezing. And as it's sort of improved, as it's been more refined, the handpieces have improved, and now areas pretty much all over the body can be treated with...
What are the most effective areas?
The typical areas would be the love handles, maybe the medial thigh, the inner thigh. The difficult areas, the hips, because you simply can't tend to get the fat into the device.
So that's probably where liposuction would come in.
That's right.
And would be more effective.
Yes. So liposuction, extremely powerful tool. We can remove most stubborn areas of fat. There's not many places that we can't place a liposuction cannula. But again, it's patient selection is the key. Because we want to make sure that we're making an improvement. We want to make sure that the patient is losing those stubborn areas of fat and seeing benefit. The last thing we want to do is remove areas of fat and be left in its place with sagging skin.
Yes, exactly.
So we, again, going back to the Renuvion, to the J plasma, a fantastic device that allows that heating of the skin to really tighten and potentially stave off a surgical procedure with a scar, and instead we can use the tiny liposuction cannulas. One of the things in my practice that I have seen is the old-fashioned would be the brachioplasty, skin and fat from the arm. Now the problem with doing that procedure, you get great results, but
you have a scar, I think.
Exactly. Yeah. And it's never a nice scar. It never heals well. And this is a scar from, here to here. And again, we're in Dubai, with the sun, etc. So we don't want to be having to hide scars necessarily. And so again, instead of a big scar, we can use tiny incisions, just enough to be able to get the liposuction cannula in, and then go over the area with the J plasma and find that we can get tightening of the skin. Okay, it might not be as aggressive as the surgical excision of the skin, but patients are more than happy to trade off that big long scar for a result that we can achieve with the J plasma and liposuction.
Let's end by talking a little bit about body contouring.
Yes.
That would probably be mostly for patients who were obese and lost a lot of weight and have sagging skin. So can you just very quickly, because we're almost running out of time,
Sure.
but can you very quickly walk us through this procedure? And I think we have a few photos to show as well.
So bariatric surgery or weight loss surgery, it's gaining real momentum here in the UAE. Here at the hospital we have an excellent centre that offers all manner of bariatric procedures. Whilst we can lose the weight, we can still, unfortunately, be left with excess skin. And what we want to make sure that we achieve is a nice sort of body that we want to achieve. Because when we look at on the screen, this is a gentleman that had lost a lot of weight, nearly 70 kilos. Now, whilst he's lost all the fat, you can see that the skin won't tighten. Now, with the best will in the world, I'm not going to be able to improve that with liposuction or the J plasma. So here we needed to do a body lift, where this involves circumferential excision of skin, and then we lift the skin and be able to give a really nice tight appearance. On the chest, we performed liposuction and the J plasma to achieve that result.
Dr. Conroy, unfortunately, we are coming to the end of our first episode. Thank you so much for being with us tonight and for your valuable input. And I hope we answered a lot of your questions in this episode tonight. Before you go, don't forget to like and share this episode on Facebook and to subscribe to the American Hospital's YouTube channel. Join us next Tuesday at 8:30 p.m. Dubai time as we delve into the world of cardiology with Professor Firas Alani, consultant cardiologist and chief of Heart and Vascular Center here at the American Hospital in Dubai. And please do come prepared with your questions. Have a good night.